Hello guys, welcome to Loving Life Conversation Series, People Who Change the World. Today we have Bruno, who's the CEO and co-founder of 28 Health. Welcome.
Thank you.
So you are a principal at Boston Consulting Group and you spent 4 years helping Gates Foundation increasing access to health. And then you founded 28 Health. How did the idea of founding 28 Health come about and why women's health?
Yeah, it's a very good question. It was a process. I actually always wanted to start a company. It's one of the reasons I joined consulting. I was like, I will see a lot of companies. It's going to give me ideas. I will see what works, what doesn't. And so over time, I worked on a couple of things on the side. It never really went anywhere. And so I happily stayed at BCG. And when I was at Gates, I met this startup called Kasha in Africa, in Rwanda and Kenya, and they are probably the first women's health telemedicine platform over there. And I just thought it was really interesting that even in Africa, in some of the most underserved communities, you can use technology to improve access to healthcare. And I thought, I think we could use that in the US. And unfortunately, there are also very large underserved communities in the US. And then the other piece,
22 days, that's the average time a woman needs to wait to even get into an appointment of a primary care doctor. But for you guys, is within a few hours and never wait more than 24 hours. How do you even get these doctors in the first place? Do you pay them? How does it work with the doctors?
Yeah, so we pay them. And even beyond a few hours, something I'm really proud is the average time for somebody to get prescribed from the moment you sign up to getting prescribed, where a lot of steps go into that, right? It's like, make sure your profile is complete, make sure your insurance is correct. You get matched. Maybe you have some back and forth with the doctor, right? You ask questions, you answer. The average time to get a prescription is 1.2 days. It's really fast, right? You sign up, 1.2 days later, basically tomorrow you get a prescription. 3 days later, it shows up at your doorstep, almost anywhere in the US. But at that time, you have not even met, a doctor. Really kind of an EMR system. So they actually connect on the 28 Health platform. It's super user-friendly. They see all the patients. They see messages they need to respond to. They see new users who just signed up, review the charts. Sometimes they follow-up task of, that person asked if they could change the brand, etc. So they connect and it's clock in, clock out. We actually have an automatic system that just sees when they connect, when they log off. We calculate the time. If they connect 3 times a day, it's going to add everything up. At the end of the month, they've worked X hours and we pay them for those hours.
So it's like the lawyers when they start writing, clogging in, whatever,
like,
clogging out.
It's like high quality and cheaper than lawyers.
Yes. Yes, and it's very flexible for them. Basically, they can dictate, these are the hours I'm available, and then your technology enable them to really work seamlessly with their full-time job, and then they can transition if they want, how many hours they want.
Yeah, exactly. And today, all of them are part-time. They probably do 10 to 40% of their time with 28. The rest, private practice, a hospital, a clinic. I actually really like that because I think it's great that they don't just do telemedicine, that they continue to see patients in person and are exposed to a variety of patients.
You mentioned about underrepresented groups, often low income, people of color. Why do you focus on this group? And also, you mentioned about the doctor has specialization within this group. What's so different about treating this group versus just the mass market?
Yeah. So on the first part, I think that's where, unfortunately, there's the biggest needs, right? If you look at the US overall, it ranks, it's horrible, but it ranks last among all developed countries in terms of maternal health outcomes, right? So in the US, on average, 1 pregnancy out of 2 is unintended, which is the lowest, again, of developed countries. If you look at maternal death, infant death at birth, STI, it's really bad. And it's even worse there's unfortunately a clear correlation between, how bad the outcomes are compared to, income levels or folks being people of color. We saw it during COVID, right? Unfortunately, we saw that, for example, COVID, the majority of women in the US are underserved. If you add up women on Medicaid, women who are uninsured and underinsured, it's 60% of the country. And most of the solutions, the new innovation that you see, which are great, are not designed for them, right?
And then your company not only gives service to people who have insurance, but also people who do not have insurance. Yeah. They can pay a monthly fee to have access to. How are you even thinking about the whole business model of how to design the pricing to serve your customers?
Yeah, that's something that's really important to us. So we actually, what's really beautiful is anyone, irrespective of their income level, can actually use Twentyeight. And I will explain why. If you have Medicaid, we are one of the very few platforms that takes Medicaid. You can use our platform, and Medicaid often covers 100%. So your copay is going to be $0. You actually get Twentyeight complete for free. Deliveries is included, customer service, it's all included. We offer all that, no more than your Medicaid rates. If you have commercial insurance, the same. So 95% of those users don't pay $1 to use Twentyeight, and we basically make money through their insurance companies. And then if people don't have insurance, they can pay out of pocket. It starts at $16 a month. $16. So it is relatively affordable, but not for everyone. So then we have a fourth program where if you have low income, typically below 250% of the poverty line, we will actually get funding for you to pay for your services on Twentyeight.
So you have a set of concrete values that you set from the get-go that leads to the decisions like, we don't make money from content. We want to have free access to everyone. And then also you don't sell data. What are some of the core values that you and your co-founders, Amy Fan, decided at the very beginning?
Yeah, I'm glad you asked. We actually had an investor last week because we are raising money at the moment and have a ton of conversations. And so one investor sent me the due diligence list. It's the first time I actually saw somebody be like, what's your culture? What are your values? And so I was like, you are lucky. It's really important for us to actually even have a document that everybody that joins Twentyeight, Amy actually does a culture session with them, talking about our culture, our values, our behaviors. So one is the mission. It's really important for us that everything we do, the North Star is the mission. The North Star is improving access to reproductive and sexual health.
You mentioned about you love rock stars, but who don't take themselves seriously. I can see the value from your website, and I'll tell you why. Because when I enter the website, it's very apparent it is for the users. It is for people who come on the site, get started. And then, I want to see, who are the founders? Who are the co-founders? What's the backstory? And then I scroll to the very end, there's the learn and about. And only there I have to scroll, you and Amy. So I can see you really put your users first and then put whoever co-founded the team is the infrastructure supporting the creation of this product. But I do want to learn more about your entrepreneurial journey. How did you meet Amy? What is the backstory of how you guys put this thing all together?
I actually worked initially on it with a friend, nights and weekends when I was at BCG. My friend Louis, and we're like, okay, like it's very hard to do as a side gig, so we need a path to know, okay, we quit our full-time jobs or not, and we decided to like, okay, let's pitch to a VC, let's build a deck, pitch to a VC. If the meeting goes well, that's the sign. If it doesn't go well, that's the sign. We did that, and I will tell you a story about it, because the story with Amy was kind of in parallel. And I remember it was before Christmas. We pitched the VC. It goes horribly. We get completely destroyed every single minute of the meeting. And we both leave the meeting, of course, a little bit down. And like, okay, let's take the 2-week Christmas break to think about this. And then just before I had met Amy, because at least my approach, which I think is very common in the US, is speak about the idea to as many people as you can. Like the European approach is more like, oh, it's my idea, it's so valuable. I don't think there's something so valuable in an idea. And if it can be copied from a conversation, it's probably not a great idea. So I'm like, it's not about the idea. I don't think anybody's going to steal it and go faster than us. So Pablo, who was my friend and colleague at BCG and Gates, is probably the third person I told, I'm thinking I might leave BCG to work on this. Like, oh, you should speak to my girlfriend Amy, because she led consumer startups before, so she's really very well versed in building solutions for consumers, in growth, in e-commerce, in marketing. I'm like, yeah, I know nothing about that. I should definitely speak to her. I spoke to her. It was a really good conversation. If I remember when she was traveling, she sent me after this super long email of like, Bruno, here, if I were you, here are all the things I would do to test the idea, landing page, marketing, etc. And then she was coming, they were both coming to New York during that Christmas break. So we went for brunch and we clicked and we're like, okay, at that point I was almost sure I was going to quit BCG and go full time. And she was finishing Berkeley and she's like, I have quite some free time. I'm happy to dedicate some to 28. So we started like this, probably around January 2018. I gave my notice to BCG. I gave 3 months because I wanted to finish projects. So I spent every little time on the side, kind of, and ramping down BCG. Early April, I quit. I was 100% on 28. And Amy was gradually spending more and more time on 28 as well. Spent the whole summer in New York. And a few months later, I think towards the end of 2018, we launched and then we officially became co-founders. So yeah, it was really good. It was very organic. And that first summer, 28, initially I was like, oh, we need a little bit of money, not even to pay ourselves. We didn't pay ourselves that first year. I was like, oh, I need maybe some people like with 20K you can build something. In the end, we raised 300, and I'm not sure it was that much. Friends and family, and I was mentioning this at weddings, and so it worked.
So how was the conversation with your wife about starting your journey? We had this conversation at Stanford, and then I asked Omar, what if I fail? What if we fail? And then he said, if you think about it in terms of success or failure, then you're not ready. That's what he said. So I'm curious, how was the conversation with you?
I'm not sure I was that wise. It to me is I mean, some of it to be honest is a little bit selfish. Of like, it definitely had a big impact on our life, right? Like it's you forgo income, a lot of income, especially in consulting. But it was still, I mean, it was probably my proposal, and since it was like, I'm not gonna put myself, against it. But I think she saw that I was really excited. I really wanted to do that, and in a way of like, it's probably the last window. Like, I'm not sure I would start again with a kid. To be honest, like, I think the risk profile is a little bit different. And we try to set boundaries of like clear milestones. Okay, we give this a year. In 1 year, I need either funding to be able to pay myself, or this has gone off the chart that it's looking really promising, right? And then probably the two are related, because if it's going off the chart, you can raise funding and vice versa. But that was the key. Like I was not gonna empty all the savings for 3 years and find excuses as to like, but nah, this year is the year and whatever. And unfortunately, I've seen friends. I think that the one of the mistakes you can really make is work on it too long until it actually works, right? And be like, oh, but it's normal, it's tough. Like, and some people, in 6 months, it's very clear it's a rocket ship, right? So, and you have anything in between. So that was really the conversation. Like, I really want to do this. I'm very passionate about it. I think we can have really amazing impact. There's a really attractive upside, like in any sub. If it goes well, it can be life-changing, right? In the meantime, it's not going to be on your startup salary, but the upside was definitely a part of me. And worst case, we learn a lot, and I'm going to go do something else after.
Yes. And I think you're the perfect example, the representation of 28 Health, because 28 Health is also the perfect marriage between mission and margin, the business model and what you want to achieve in a bigger impact. I always want to end with something more personal. So now you have a 2-year-old Becca, and how is it life for you as an entrepreneur, as a father? If I would ask Cecilia, how would she read you as a father or a husband, what would she say? And what would you give yourself? How much time and energy are you able to dedicate to your life and family?
Yeah, it's a good question. Not sure she would give me the highest score, for sure not. I think Becca would probably give me a good score. I mean, it's a lot about quality of time. So like some folks maybe have more free time than me, but I mean, I see them on the street, like they're always on their phone and they put, iPads in front of the kids. I have nothing against people who put iPads in front of kids, but like, I think something we really try with Becca, Cecilia also works really hard, right? So it's not just me. Is spend quality time. Like, no phones. Even if I have 20 minutes in between my last call and putting Becca to bed, it's like, take those time and high quality time. So I think that helps.
So it's really about quality of time, because when you become the best version of Bruno, then you can become the best version of husband and father.
I think that's the same at work. And to be honest, I'm far from perfect, but if you decide to go into a meeting, be in that meeting, right? And engage and listen to folks, and if it's not efficient, make it more efficient. Make it more efficient. But versus kind of doing everything kind of half baked and half there. Yeah, I like, we split with Cecile. Like, I bring Becca typically to daycare in the morning, Cecile does the evening, or sometimes we swap. I think there's also a lot of dividing and conquering. Like, we don't need to do everything, the three of us together. So on the weekend, we'll often say, okay, I take the Saturday morning, you take the Sunday morning, so that if you can sleep a little bit longer, you do. I mean, anyway, every parent has their own tactics.
Yes. It's about delegation and collaboration. Yes, so it's the same for leading teams. And my last question to you, I think you alluded to a little bit, which is, how do you measure the success of your life?
I think it's probably, similar to your question before, like my happiness and happiness of people around me. Well, definitely not as high as I, would want it to be, but working.
For you or for the family?
Probably both. I think it can always be. I mean, honestly, overall, I think it's really good. But yeah, it can always be better. Things like, how can we better protect vacation? How can we have a family in Europe, so I would love to, be able to spend even more time in Europe, Becca to spend even more time with the family there, go to camps, whatever. But yeah, to me that's probably number one, because I think everything else feeds into that, right? If you paid more, that should help you have higher quality of life, or take more breaks, or get more support, or spend more quality with your legs. So yeah, that's the way I would look at it.
The happiness of your life and then people around you.
Yeah.
Thank you so much.
Close friends, close family.
Yes, close friends. And I want to say one thing. I think even for you to start thinking about what the elements of your life can be improved, I think this is the first step of making it happen. I have no doubt within a few years or even a few months, you're on the path of achieving all of those things in your life.
Thank you.
Yes.
Thank you, Faye.
And thank you
so
much.
Pleasure.
Bruno. Yes,
thank you.
Pleasure. Hug.
Have a good day.
Oh, yay!
Thank you, guys.
Thank you.
This is fun.
Yes.